how to understand Doshapaka and Dhatupaka based on the physiological and pathophysiological understanding. This is the topic of discussion in this particular video. Dear ANA community, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. When you think about the Doshapaka and Dhatupaka, this is a description available in Madhava Nidana in the context of Jvara. Actually, so this is nothing but the concept of the restoration from the abnormalcy. That is what we can say the Doshapaka, and from the normalcy moving towards the abnormalcy, that is considered to be the Dhatupaka. It is been mentioned in Madhukosha commentary. Dhatupaka dhanti malapaka vimunchati iti vyavasthita vikalpaha. Whenever there is Dhatupaka, so that will be leading to the destruction of the human body. Whereas malapaka, it is also being termed as Doshapaka, that will be considered to be restoration of the health as such. Restoration of the health. Whenever if you think about the causative factors for this Dhatupaka and Malapaka, it is mentioned that Daivameva. So the probable cause of this is considered to be idiopathic. And Uttarottara Buddhi Balahanibhyam Shukradi Dhatu Saita Mutradina Cha Dhatupako Jnayaha. Whenever we are going to say there is a Dhatupaka, so that will be considered to be the gradual destruction of the Shukradi Dhatu along with the Mutra, Purusha, etc. that is going to take place in case of Dhatupaka. Whereas Anya Dhatu Malapaka, if that is not happening, if that is happening, then it is considered to be Doshapaka. The textual description, it is only related to the Lakshana, that is, we are going to see that Nidranasho Distambu Vishtambo Gauramaruchi Aradir Balahanishta Dhatunam Paka Lakshanam. Whenever the person is having Nidranasha, loss of sleep, Hridistambaha, that is the discomfort in the chest, Vishtambaha, that is the maybe what we can say the constipation, etc. Gaurava, heaviness of the body, Aruchi, that is tastelessness, Aratihi, restlessness, Balahanihi, that is what we can say the reduced strength or loss of strength, or what we can say fatigue as such. So this is what is considered to be the Dhatupaka Lakshana. Whereas Doshapaka Lakshana, that is Dosha Prakriti Vaikrityam. So that is the Dosha Prakriti, that is the reversal of the Dosha Prakriti. The nature of the Dosha Prakriti is vitiation of the body. The reversal of the vitiation of the body, that is nothing but the maintenance of the health or restoration of health. Lakuta Jvara Deha Yoho. So that is Jvara Lakuta and Deha Lakuta. Jvara Lakuta, that means the lightness of the symptoms of Jvara. And Deha Lakuta refers to the lightness of the body as such. Indriyanam Chavaimalyam. So that will be considered to be the Vimalata, that is the normal functioning of Indriyas in terms of the Jnanendriya as well as Karmendriya may be there. So this is what we can say the Doshapaka and Dhatupaka as such. Whenever a person is having any kind of the Nidana Sevana, there may be the possibility of the Lakshana that may be observed in between what we can say the Doshapaka and Dhatupaka. If that is moving towards the worsening situation, we may say that the person may be having the Dhatupaka Lakshana. If that particular symptoms, what we can say, that is having the restoration, then we are going to say there may be the possibility of the restoration of the health as such. Whenever if you think about the Dhatupaka, we need to know about the microcirculation. What actually is this microcirculation refers to? So microcirculation, that is consisting of the capillaries as such. The human body consisting of 10 billion capillaries. 1 billion capillary refers to 100 crores. 10 billion refers to 1000 crores of the capillaries are present in the human body. So each of these capillaries that will be having this certain movement. So in each of these, the average movement that happens in the capillaries, that is 0.3 millimeter per second. And the movement that is happening in that, the main reason for this is considered to be Starling forces. The Starling forces are those which are considered to be the which are considered to be happening because of the presence of the fluid and other proteins, elements, etc. in the blood vessels. Suppose if this is a schematic representation of the capillary and this is the schematic representation of the interstitial space. So whenever if you think about the movement of the blood is happening in the capillaries from the arterial end to venous end. So this happens because of the presence of the certain amount of the pressure which is being exerted by the left ventricle, what we can say the blood pressure. So that is responsible for this kind of the movement. Whenever if you think about the blood pressure, so there are responsible for the difference in the pressure as such in the capillaries also. So whenever we think about the capillaries, there are basically two types of the pressures. They are actually exerted across the capillary membrane. One that is the oncotic pressure, second one that is the hydrostatic pressure. Whenever we think about the hydrostatic pressure, that is actually exerted by the water portion present in the blood. Whereas the oncotic pressure, that is actually exerted by the proteins and electrolytes present in the blood. Whereas the tissue tension, that is a type of the hydrostatic pressure that is happening in the interstitial space. Whereas oncotic pressure in the interstitial space also, that is being exerted by the proteins and electrolytes. Whenever we think about the pressure, the amount of the pressure at the capillaries, suppose if the blood pressure is 120 by 80 millimeter of mercury, the hydrostatic pressure will be at the arterial end, it is 32 millimeter of mercury. And oncotic pressure, which is being exerted by the proteins and electrolytes, that will be around 25 millimeter of mercury. Whereas at the venous end, as there is no change in the difference or no change in the proteins and electrolytes, venous end also the oncotic pressure will be the same, that is 25 millimeter of mercury. Whereas the hydrostatic pressure, that will be around 12 millimeter of mercury because of the displacement of the fluid from the capillary to interstitial space. Whereas the tissue tension, which is nothing but the hydrostatic pressure of the interstitial spaces, it's around 4 millimeter of mercury, and oncotic pressure, it is around 8 millimeter of mercury. So when you think about the Starling forces as such, they are happening at the arterial end, what we can say the hydrostatic pressure and oncotic pressure at the arterial end of the capillary, that has to be negated with the hydrostatic pressure and the oncotic pressure at the interstitial space, which amounts to be the 11 millimeter of mercury. That means with that amount of the pressure, the fluid, nutrients, etc., that will be moving from capillary to interstitial space. Whereas the venous end, it is actually happening, that is hydrostatic pressure at the oncotic pressure at the venous end, and the oncotic pressure, tissue tension and oncotic pressure at the interstitial space. So that is amounts to be minus 9 millimeter of mercury. That amount of the pressure, the metabolites, water portion, etc., that will be moving from interstitial space to capillary. This is the actually the mechanism of the Starling forces, which is very, very essential to know about the pathological understanding and physiopathological understanding or pathophysiological understanding as far as the human body is concerned. It is being mentioned the increase in the hydrostatic pressure, maybe the volume of the blood is going to get increased, or decreased oncotic pressure, or decreased proteins and electrolytes in the capillaries, or there may be the capillary damage, mucosal damage, capillary membrane damage, or there may be the lymphatic obstruction and the water and sodium retention. So these are the 5 different mechanisms wherein the edema may be manifested, which is considered to be one of the very important findings which may be observed in case of inflammation as well as in case of the degenerative conditions. When you think about the inflammatory mechanism and Dhatupaka, what actually happens is, suppose if this is considered to be the capillary bed, suppose if there is the capillary dam, the inflammation has happened, some pathogens are being present, so that will be responsible for the production of the proteins. In the sense, the interstitial space that will be having increase in the proteins, etc. Because of that, the fluid that will be moving from capillary to interstitial space. Because of that, there may be the possibility of damage to the capillary. This will be leading to the movement of the even RBCs, WBCs, etc. from the capillary to interstitial space. So this will be responsible for the increase in the swelling, redness and warmth of the affected part or injured part. This will be responsible for the WBC interaction with the inflammatory markers, etc. That will be leading to pus formation. Thereby, the person may have the pain, disturbed sleep in case of the very severe inflammation because of the increase in the fluid, etc. That will be responsible for the heaviness of the injured part, and there will be inability to move the injured part that may be observed. All these are considered to be the outcomes of inflammation. That is indicative of what you say that the Dhatupaka as such. Whereas the degeneration as such, what actually happens here? Again, there will be inflammatory markers, they are going to get produced. Because of that, there will be the capillary damage that may happen. This will be leading to the increase in the interstitial space. Thereby, the more fluid that will be entering into the interstitial space. In that way, that person will be having the swelling, redness, raised warmth, etc. That will be associated with a clinical presentation such as the pain, disturbed sleep, heaviness of the injured part here, that will be considered heaviness of the joint that may be observed. Thereby, the person may have the inability to move the limb that may be observed. Again, this could be considered to be a Dhatupaka. Now, how to understand Dhatupaka as such? Whenever in case of the inflammation, what actually happens is that will be leading to the transfer of the fluid from the intravascular compartment to interstitial compartment. Then there may be the possibility of the movement of the fluid from the intravascular compartment to the interstitial compartment, and from the interstitial compartment to the intracellular compartment that may be taking place. This is what happens in case of inflammatory mechanism. Whereas in case of the degeneration, what actually happens is the pathogens that will be present in the interstitial compartment and that will be entering into the intracellular compartment, or otherwise there may be the possibility of the presence of the pathogens in the interstitial spaces itself. In that way, we are going to observe the pathological mechanisms that can be observed in case of degenerative conditions. As far as the concept of Doshapaka is concerned, removal of the pathogens from the intracellular compartment to interstitial compartment, from the interstitial compartment to intravascular compartment, and from the intravascular compartment to enter it into either stomach or small intestine, large intestine. Suppose if the pathogens are present in the interstitial compartment, not in the intracellular compartment, making it to move into intravascular compartment, from there to stomach, small intestine, large intestine, that is considered to be the mechanism of a Doshapaka. Suppose if the pathogens are present in the cells, then if it is a localized one, then ideally that has to be removed from the intracellular compartment to the exterior. One of the possible way is considered to be Rakta Mokshana. Whereas, in case of the degenerative conditions, the movement of the pathogens from the intracellular compartment to interstitial compartment, from there it will be entering into the intravascular compartment, from the intravascular compartment to either stomach or small intestine, large intestine. That is the Doshapaka understanding as far as the degeneration is concerned. Suppose if the degeneration is of localized one, then we can straight away give the treatment so that that will be eliminated directly to the exterior. That is in case of the Rakta Mokshana. In this way, we can able to understand Doshapaka and Dhatupaka as such. To sum up, restoring the physiological mechanism that is considered to be the Doshapaka and understanding the pathological mechanism that is considered to be the Dhatupaka, that is considered to be the very essential components as far as the concepts of Roga Nidana is concerned. Dosha Prakriti Vaikrutyam Lakuta Jvaradehayoho Indriyanam cha Vaimalyam Doshanam Paka Lakshanam indicates Doshapaka Lakshana, Nidranasho Distambo Vishtambo Gauravaruchi, Aratirbalahanischya Dhatunam Paka Lakshana, that indicates Dhatupaka Lakshana. By applying the principles of Starling forces in Doshapaka and Dhatupaka concept, we can learn the concepts of inflammation and degeneration in a deep understanding as per the concept of Roga Marga. Dear ANA community, that's all for today. What are the major key takeaways of today's discussion? Mention in the comment box below. What is the one video they'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of students and learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.